All right, fantastic. Good afternoon, everybody. Welcome to the April 28th, 2026 MFRAC meeting. I am VJ Kapoor. I serve as the receiver for the city of Chester. Join with us today. Looks like sort of a lighter group today. Mayor Stefan Roots is here from the city of Chester. Mr. Andrew Sheaf from DCD is unable to join us today. Ms. Kelly Diaz and Councilman Shaquan Davis may be joining us in a little bit. From my team, I've got Jacob Polikov, who's my special assistant, and Cody Deal, who is my executive assistant. So good afternoon, gentlemen.
Good
And
afternoon.
we also have a special guest from VMSC. We will be having a little presentation about the ambulance services contract that VMSC has been providing and has extended. We've extended with this VMSC for the city for the next 5 years. So very, very excited about that. But we will get to that in a moment. First, I just wanted to just start, if we could, on where we were at the last MFRAC meeting, which was, if many folks remember, this was the opportunity for Justin Tibbles and the city and the mayor to show off the new request button and system for the city. Things for abandoned vehicles and nuisance issues and whatever. And if folks may remember, I actually put in something for an abandoned vehicle. I wanted to let folks know kind of where that is in the process. We're continuing to follow that. I made that submission on April 14th. On April 17th, I got an email from the city from no reply at tracer.com. That's the email I got it from, that said it was in progress. And so what I understood, that's what I got from the front facing. What I understood was going on behind the scenes was the city was working to take a look at the vehicle going out there. I've received an update that last Friday, the vehicle has been tagged with a sticker noting that it is abandoned and that the city has sent a letter to the individual who believes owns the vehicle, who has 7 days to respond. And if that doesn't occur, then the vehicle may be towed. So we will continue and see how that's going. But I wanted to let everybody know that is in progress. So for any of you who may have submitted your own requests, I can assure you that they are being worked on. I know we got quite a few in the first week. So that's a little update from my end. Mayor, did you have anything that you wanted to for the good of the committee, or anything you wanted to update everybody on?
I think I'll just piggyback on what we're talking about, that Chester Connect app. I'm having a great time directing people to the app because I get a lot of direct phone calls or emails or texts about things that are really easy to submit, with the app. So it takes a little back and forth with these people, especially when they say, "I thought the mayor could make all things happen." And they don't realize, and I try to explain to them that when they call us, we end up calling the departments and, putting it in their hands. And now, people have that power themselves through the app. Those requests go right to the departments that resolve the problems. And the best part about it is, like you said, in a couple of days, you got a response. More than likely, they're not going to get a response from me when I submit something to another department. And that's really what the benefit, I think the true benefit of this app is that it keeps you, the person who submits the request, in the loop. It is not, as much as someone might complain about their neighbor who has high grass, and they call us and say, "My neighbor has high grass and weeds." There's never been a facility where that person who puts in the complaint gets an update ongoing what's going on next door, because they keep looking out the front window and the grass just keeps growing. They have no idea that we received a complaint, that we've reached out to the owner, that we've sent them a letter, that they might have even been cited. So it gives me, with the app out there, gives me an opportunity to snatch people's phones, and I literally do, and help them download the app, show them how to use it. Correspondence get a little long when people really think like they call the mayor and things magically happen, but it doesn't take long before they see it's a much more efficient process to do it themselves. So it's still a learning, process. And we're even learning, like you said, on the inside, there's a little tweak here, a little tweak there. You fix one thing and break another. We're going through that process right now. But this app is really a great game changer. So I'm glad it's launched, and I want everybody to download and try it.
Great. Thank you, Mayor. We'll continue, just keeping in touch on some of the ones that we've put in there, and I can tell the public, the departments are reviewing them, and they're all logged in as well. So we'll be under the city will be working through that. So with that, let me turn to VMSC. So we've got Shane Wheeler from VMSC. The news here. Let me before we let Shane take it and talk about some of the good work that VMSC has been doing for the city over the last year. I just want to preface it with just again kind of an update. And anyone who may have seen the Delco Times today will see an article about the contract that City Council and the mayor approved last week, a 5-year agreement with VMSC to continue to provide ambulance services over the next 5 years. We're very excited about that. Anytime we mention VMSC, we always want to thank Dr. Monica Taylor, who put VMSC in touch with the city and at a time where the city was in a difficult spot, came in and I think exceeded all expectations when Crozier closed. So we're thrilled to have them locked down for another 5 years. Shane, let me turn it over to you. You can unmute yourself, talk a little bit about who you are, and I asked Shane, to put together just kind of a short presentation about their experience here in Chester. So I hope this is informative for everybody. Shane, you can take it away.
All right, thank you, and thanks for the opportunity to update the community with regards to what we've been doing over the past year. Yeah, so I'm Shane Wheeler. I'm the Chief Executive Officer of VMSC, and VMSC is a mobile health nonprofit company that provides services like emergency medical services, mobile integrated health and specialty transport services for people like customers like Children's Hospital of Philadelphia, Trinity Mid-Atlantic, and Jefferson Health, for example. Um, we're a old system. This is I think, our 93rd year in business, and Chester City is our newest, kind of member to our corporate community, and we're really have become just in love with the community and the people that live there. So, doing some really remarkable things in the city of Chester, and I've got this presentation to kind of highlight some of those things. So, previous 365 days, we've just shy of 9,000 responses in the community. We transported 5,800 or so of those patients. Our refusal rates and no patient contact rates are among the highest in any of our operation. Um, so that's something that we've come to kind of learn about the community with regards to with the limited access to preventative health programs, physicians with the closure of Crozier and just the long wait times to get appointments and so forth and establish new physician relationships. We've become kind of the default preventative care side of things, and responding to calls that you wouldn't traditionally expect an ambulance or an EMS team to kind of manage, whether that's medication reconciliation or blood pressure checks or just answering their health questions, which we're happy to do that, but it does change the dynamics again on a fee-for-service type industry. The top responses that we respond to, interesting. Uh, Chester City is unique in that in every other municipality that we provide, the number one or two response we do in a community is falls. In this case, it falls down. Certainly, falls are a challenge in Chester City, but what really drives the narrative here is breathing problems. Sick persons is always our top, but that's kind of a catch-all category. But breathing problems, respiratory problems in the city of Chester is huge, particularly among the pediatric populations there. We are seeing a significant number of responses that surround breathing emergencies in the community. We're super
And
proud.
Shane, if I could stop you there, is that asthma? Like, tell us more about that, because that, again, that is pretty unique. Can you tell us? Can you drill down a little bit more on that?
Yeah, for sure. Typically with a pediatric population, it is generally asthma kind of sourced. But in general, we respond to COPD calls, emphysema calls, congestive heart failure calls in the general population. And asthma is a primary response that we do for pediatric emergent respiratory problems.
Thank you.
Sure. I was super proud of this. Our shoot time, this is a time from the time we get alerted to the time we're en route is 7 seconds, the best in the organization, followed by our best response time system-wide. We were, response times was difficult to kind of, dive through the data prior to VMSC, but it looked like response time exceeded 12 minutes prior to us, and we're under 6 minutes. So a significant reduction in response times for the citizens of Chester. We're super proud of that and of that number, and it makes a difference. We're shifting our focus away from necessarily the traditional metrics that systems would look at, like response times or transport rates and so forth, and really shifting to measures that I think are more imperative, right? Identification of treatment from onset of symptoms to intervention of care. And we've kind of focused in really five areas, trauma, which isn't on the screen. I'll talk a little bit in the upcoming slides. STEMI, which is our heart attacks, which stands for ST elevation myocardial infarction. It's an indicator with a 12-lead EKG that suggests that a patient's having a heart attack. Stroke, overdose, and pediatric emergencies. The five care, those are the crux of emergency life-saving care. And we're really shifting all of our measures to support these areas in our communities. These are the calls. These are the types of responses that really it's important to have good response time, and more importantly, to have a good capability to manage the scope of the complexities associated with these cares. Meeting patients with the right training, equipment, and getting them to the right destination so that we can have positive outcomes, which is what we're working towards. Cardiac arrest survival. I got to move my little screen over here. Yeah, thanks. Really remarkable numbers. We've saved 28 lives in cardiac arrests in the last 365 days. Our ROS rate is 31%. That means that ROS stands for a return of spontaneous circulation, that they did not have a pulse, and we got them to the hospital with a pulse. It's a real true measure or cardiac arrest impact that our role in that process. But we're really proud of the fact that 28 patients are alive today because of the system that we've built in Chester City. The other big thing that we do in Chester City, which is among only about 360 communities in the United States, have the capacity where their EMS system can administer blood transfusion in the field. We're the only system in Delaware County or Montgomery County, Bucks County, and Philadelphia that have that capability. Tower has the capacity in Berks, I believe it is. But we're the only ones in the area that can do a blood transfusion in the field. And to date, we had 10 patients who received blood, and it's not necessarily what you think that you're receiving blood. These are medical patients. These are obviously the shootings and stabbing type trauma, penetrating trauma patients, but it's also, a dialysis patient who had a compromised shunt that would have probably exsanguinated if we had not been able to deliver the blood. So huge a huge capability in Chester City with regards to emergency medical services. It's truly making a difference. Beyond the response, we're working with several of the hospital systems on how we expand, clinics and preventative care for our vulnerable populations, specifically children. We've been in conversations with the Moores and Trinity Mid-Atlantic on how we do outreach in the community to do that. Some dialogue with Catholic Charities is involved with that to try to, how do we get access to more definitive care, preventative care for the citizens of Chester. Um, um, we're working on rolling out a community mobile health or paramedic program that would. We have a lot of calls, as we've talked about, that don't necessarily need an ambulance to respond, but definitely need a level of medical consultation to work with people to get them to the right care, to coordinate with a primary care physician, establish a primary care physician relationship, um, work with transportation options. How do they get there, whether that's Uber or shuttle services, which is another thing we're working closely with Trinity Mid-Atlantic on is, providing free shuttle services to and from hospital systems so that one of the big barriers for people to get care is they don't know how they're going to get back home. And we're trying to help solve that problem from a network approach with our hospital partners.
Shane, like you mentioned this earlier, this was one of the things when we were talking, just the non-response rate, right? And do you mind just kind of touching on that, just from like a business end, right? And how it kind of relates to what you were talking about here and refusal and that. Just for people who are, you know, uh, who just don't sort of understand kind of what I would call like the business side of this and why that matters to you guys.
Yeah, sure. So EMS systems in a whole are get funded through fee for service, meaning that you transport the patient and we bill Medicare, Medicaid, or a third party insurance carrier, and then that's how we get funded. Um, if there is no mechanism for us to receive reimbursement from an insurance carrier if we do not transport the patient. So if 30% of our responses and time is engaged in care that can't be compensated, then that's what has created the gap and why we've asked for funding from the municipality to support that, to close that gap. Um, it's an unfortunate dilemma for emergency medical services to be in, but this is why many systems around the United States, as we experienced with Crozier and multiple other, like over 40 some systems have closed or shuttered in the last year or so within the Commonwealth because of this gap and unable to find sustainable alternatives. So it's best for the patient if they get the right care where they need it. The solution can't be that we're sending the most expensive mode of transportation to the most expensive access point for healthcare, meaning an ambulance and an emergency room. So if we can come up with other alternatives, telehealth, mobile integrated health programs, and working to try to bridge those gaps, it's going to lead to better outcomes for the patients and the community by establishing better relationships, as well making sure that the ambulance are kept available for those priority emergency responses. Interesting data that was just released that truly only about 8% of all emergency 911 calls for EMS are the life-threatening, kind of calls that, the bells and whistles kind of calls. And 20% of all responses are repeat callers. So 20% of all our responses that we do are to the same high utilization populations because they don't have any other option to get their health care. So we're trying to formulate partnerships that make sure that patients get the right care where they are.
I'm curious about that number. Is that a high number, 20%?
Yeah, it's kind of astounding, right? Those are national numbers. We haven't dug into those numbers and do comparable for our communities.
Okay.
But I would suggest I believe our numbers are probably considerably higher than that. But I understand why they are, right? And I think that there's a lot of challenges within the Chester City, right, with regards to a little skepticism about healthcare, right, particularly after the experience with private equity involved in their healthcare, and so. then it's expensive. And unfortunately, some the current administration guidance with regards to re-enrolling every 6 months and trying to keep up with all that, I think leads the community to just feeling lost and on how they access healthcare. So, as I've kind of alluded to in the financial review of the operation, it basically costs us about 270,000 ish a month, or 3.2 million annually, to operate. Um, the current collection rate is somewhere around 62%. The VMSC's average, which is about 75% elsewhere. Um, so this creates that gap of about 470,000 for this past year, which was the number that we started at with regards to our request with the city. Um, Uninsured patients are a primary driver, which is about 16% are uninsured. That number has actually increased since we started. And I directly relate that to some of the decisions that CMS has implemented with regards to a tighter control who gets access to healthcare benefits, and then the complexity of maintaining healthcare coverage. And I suspect we're going to continue to see those increases for the short term anyway. Um, and those uninsured generate approximately $420,000 in unrecoverable charges. So that's a little over $1 million in uncompensated care annually. Um, in addition, our operating costs continue to rise as the price of fuel, the everything, and just like in our households, right? I do the hamburger thing, right? What used to be a pound of hamburger was well under, $4 or $5, and now, it's creeping up closer to $9 in places. And so, no different than in our personal households, and the VMSC and the municipality for sure are feeling those crunches of supply chain challenges, increased cost to operate, and we're certainly feeling those as well. Um, so, the plan that we worked out with Chester City was to allow us to cover that gap. Um, to work with us on being able to sustain the operation with equipment replacement costs, and adjusting salary and compensation so that we can keep and retain our staff over the time frame, and just adjusting for the economy. Um, uh, in working with us on some grant funding and so forth that we can utilize to kind of maybe even offset some of those costs back onto the municipality, which we've been actively pursuing. So that's it for a nutshell. I'm happy to answer any questions.
Just one thing I wanted to throw out there, Shane, just and I saw, just the Inquirer just picked up the story as well. I just saw the thing over there. Just for folks to note, in terms of the numbers you guys may be seeing about there's a number of $2.8 million, which is the overall cost over 5 years. So that is not $2.8 million a year. That is over a 5 year period, which is roughly probably a little over $500,000, if you kind of want to average it out,
Sure.
which includes both operations as well as capital. And as Shane was indicating, in the event that we're able to get some grant funding, right, for ambulance equipment, there is a provision there in the contract that, we can essentially not have to pay a certain amount if we
Sure.
get grant funding elsewhere. So, I think I will say, I mean, I think this is a fantastic agreement here for the city, for the residents, based on the level of service that you're receiving, um, from VMSC in terms of some of the, again, some of the specific things that Shane talked about. In many respects, you all have, in some ways, sort of replaced the hospital, right? And and there's many times that I know the mayor gets calls or I get calls about, well, what are you gonna, when's the hospital going to reopen? That's not something we can do, just to be very blunt with people, right? That is just not something a city can do. That is not something the receiver's office can do. What we can do is, as best as we can, help provide services and help fund services that can, as best as they can, try and replace that. And VMSC, both in terms of the response time, in terms of some of the specialty services that Shane just talked about here, is really the best we can do, and is certainly over and above what you would see in many other communities across the state. So, Shane, I thank you for that. Did anyone else have any questions for Shane? Anything else that folks from the committee wanted to ask Shane or comment on?
The only thing I would add is to internally, the fire department had presented a plan which was about $2 million a year to operate a BLS level of service. And although the contract specifically outlines a basic life support level of response, we have committed to over deliver in that area because we feel the citizens really need advanced life support and blood and advanced formularies that we provide in the community. Um, so I think when you really look into that perspective that, the total operating budget over 5 years is 2.8 million, it comparatively, that number would be significantly higher, over $10 million if if it was ran independently, on behalf of the other plan, other option that the city was considering.
Yeah, and you guys work well together. That's great. I mean, the ambulances are stationed at the firehouses, and it looks like that's worked out well in terms of kind of working together. I know during the snow event we talked about this. You had the fire department out with a pickup truck with a plow, leading the charge for you guys when they went out. So many thanks to the Chester Fire Department as well. For working together with everybody in order to again to provide the best level of service to the residents. Anything else from the committee? Anything for Shane? Any comments or questions? Mayor, I know you're getting there. There you
Unmute.
go.
There it is. No, all I can say is what I continue to say when I see Shane and his crew. Thank you so much. And my big thank you is just keeping your word. Like when you came and spoke to us and said what you were going to deliver, when I think back on that, it is almost funny. The meeting ends and then we get in our little groups and we're whispering to each other like, there's no way they can do that. But they said they can. They said they can. So we're going to go with them. We're going to see what they do. And you actually did. I mean, you guys have been more than just ambulance service. When you said you're going to come in the community and have like community days and teach people first aid and really become embedded with the community, you do that. You did that. So in short, I'm going to say that the city has been short on organizations, especially from outside of the city, keeping their promises over the years. And you're a great example of a group that has come in and certainly delivered on what you said you were. So thank you so much.
You're welcome. Our pleasure.
Great. Anything else from the committee? All right. Everybody, thank you for the time. Shane, thank you for all the work you guys are doing. It's great to see you. Um, uh, we may have you back in a couple months if there's a kind of a mid-year report or something, just to see what you guys may be seeing. For everybody else, our next MFRAC will be May 12th, Tuesday, May 12th at 1 p.m. So thanks, everybody. Have a wonderful day, and we will talk to you all then. Take care. Bye.